Hi, Wendy.
Hey, Theresa.
Thank you for jumping on this call. I've been really reminiscing about the old beta days.
Oh my
And
gosh.
yeah, I know. It kind of makes me a little bit tearful. Yeah, it's just like like that kind of original crew goes so far back, and the work that we did is just kind of mind blowing, you know?
It is. I don't think we even realized. I mean, at the time, we got so many eye rolls for being, quote, Hayes, even though I was doing Hayes before it was called Hayes. And obviously, Beta was like leading the way. But boy, oh boy, did we get a lot of eye rolls for that and
Yeah.
shunned and questioned. But it's really uplifting to see that in some ways the field has, but it's also uplifting to see how that took off and the younger generation of folks like really getting it and being very like principled in
Yeah.
those concepts, which is
Yeah.
exciting.
Yeah, so as I was like getting ready to do the second conference and thinking about that, I just really want to take a moment and thank you for your contribution, not only to the field, but to being willing to participate in the conference last year and this year. And, with your, the program you co-founded Within Health, is it Within Health? I want to make sure I get that
Mhm.
right. Yeah.
Yeah, within health and Galen Hope. Yeah.
And Galen
Mhm.
Hope with Within Health, one of the things that I really love about that is it gives people who wouldn't otherwise have an opportunity to get help and treatment. It gives them that opportunity because it's virtual and online.
It's really touching and powerful to see what people do when they have the opportunity to get help. I wondered, when we started with Hen Health, I was like, are people going to really come? Like they're in home and like there's so many distractions or other things that they
Yeah.
could do. And it just shows that people really do want the help. Like we bringing it to them and they show up and they put in like really good work. And what I realized is it is actually possible to both be in your home and in good treatment.
Yeah.
But, going back to your conference, I just, thank you for inviting me this year and last year. I mean, last year it was just an idea that you had that, and you just ran with it. And I recall walking in the ballroom that first when we got there, and it really had exceeded all expectations. And I guess you would say, or one would say, it had legs. Like it was bigger than you anticipated. It was there. You filled a need, in that area that was just really a big gap. And the crowd was so enthusiastic and warm and engaged. The conference was so principled on some of the core things that really I think make a big difference in the field for the patients that we treat, and frankly the clinicians also. So I'm just excited about it because you know there's assumptions sometimes that when you have a conference it needs to be in Miami or New York or Atlanta or something like that, and you put it there. I think people underestimated
Mm.
that this was going to take off. So I'm really happy that I got to be there last year, and I think it's just going to continue to build. So my
Yeah.
hat is off
Thanks.
to you.
Yeah, really, I appreciate that. And there was some talk about having this conference because it's internal family systems theories
Right,
with eating disorders about having it just straight virtual. And for me, it felt really important to have it be
right.
in person and virtual so
I
that
love it.
this tri-state area could get an in-live conference here. So tell me a little bit about the talk you're going to be doing.
So we decided that I'm going to do the talk on intergenerational trauma, which is a big area of passion, love, and interest. And I think it fits so well in with your overall, theme of the conference with incorporating IFS and eating disorder work because true powerful eating disorder treatment, as cliche as it sounded, absolutely is trauma informed. And really good eating disorder treatment, I think, is about really having a clear, for me, I'll just use the language we all use slightly different language, but a true understanding of the psychodynamic aspect, like what's driving the eating disorders, what's the systematic issues that are alienating that person with an eating disorder, along with, like, of course, the behavioral components that are necessary. And but the true healing happens in that context of like deep understanding. And so by integrating the IFS with eating disorders, it's going to help clinicians have a foundation. It's critical in good eating disorder work to have that foundation, that deep curiosity, that compassionate curiosity for what is actually driving the eating disorder. Not it's not, when you say it's not about the food, yeah, it's not about the food, but it is also about the food. So we have to do the behavioral work as well. As the saying goes, feelings chase behavior. So we got to be able to do the behavioral change. But if we don't do the psychodynamic, the connecting, using um, in this conference, we're going to really be digging into using IFS. If we don't bring that along, people can't really actually heal. They might change their behavior while in a contained setting, but they're not going to really, really heal. So I think the topic, using IFS with eating disorders is powerful. And then bringing in the intergenerational trauma is so important. And for me, my personal history with it, which I think is that I'm the child of a Holocaust survivor, which for a very long time I didn't really talk about in the field very much, but I came out and started talking about it more many years ago. I did a talk with Joanna Kundal on the subject from the Alliance. And so I've just, as the field has progressed and the understanding of epigenetics has evolved, and uh, even post COVID and thinking about the trauma of COVID and the pandemic, which was interlaced with George Floyd and Black Lives Matter, and a deeper understanding of how trauma is affecting um, certain marginalized groups within our country and how that interconnected with the much more devastating effects of COVID on certain populations in our society. That all just kind of came together for me of like, I want to go deeper and deeper and deeper into this. So I hope that my talk will have some practical
Mm.
aspects that can really help people, with their formulation or how they want to approach eating disorders. And I hope it'll be a little bit of like a little bit of sharing on my part just
Yeah.
to connect with the audience
Yeah.
too.
Yeah. It's awesome.
So we'll see how that goes.
Yeah, and the behavioral piece, the other thing that I wanted to note is one of your dietitians, um, Katie Cox, is going to be doing on the second day where there's the breakout. And I did
Yeah.
a little video with Katie and Molly Kellogg.
Oh,
And
that's so
so
great.
when I got trained in IFS, like in the early 2000s, the philosophy that we had in the treatment center was like everyone got trained in the model, from the dietitians to the psychiatrists, just so
Right.
we're all coming from this place of curiosity and compassion around the symptoms versus this
Sure.
rule bound way. So I'm just
Right.
so appreciative of Katie being here and having Within Health and Galen Hope sponsoring the conference. I'm just so grateful for you.
Well, I'm grateful that Katie is there and I coming in and back in the day, back in the olden days,
Yeah,
I used to, that's cool that your program trained everybody because I was back in the days where it was taboo. There was this thing that, oh, yeah, the dietitians talk about food only, and the therapists, like, they never talk about the food. And
yeah,
God forbid the therapist talks about the meaning of cheese.
uh-huh,
And really, we're all just like human beings coming into the room with these
yeah,
other human beings, and we're on equal playing level with our fellow human beings who suffer. And, when you're a dietitian, sometimes it's really important to find out what's happening at home in your relationships, or you and your partner, how to fight. It's like you got to have that relationship, whether
yeah,
you're a dietitian or a therapist or whatever. And so I really believe that those are false boundaries that shouldn't exist, and that by the whole team having an understanding of, like you said, that compassionate curiosity, that just makes the relationships much more deep.
yeah. Well, I know you're super busy. I totally appreciate you taking time out of your day to hop on this call with me, and I'm looking forward to seeing you in a few weeks.
Oh, completely my pleasure. And just my shout out is to you because I mean, to be able to get 16 CEs, like whether you could, be in person if you want that contact,
Yep.
or be able to access it virtually. I mean, you're making this really accessible, relative to other conferences with that many CEs. Like your price is like half what a lot of conferences are. And I think your topics are extremely rich and deep. So whether people are local and come in person or sign up virtually, like this is a really very clinically rich experience. Your speakers are great, and I really, wish you all the best. And I hope that a lot of people sign up throughout the whole country. I hope to see people virtually or in person, because this is a really, this is a passion project for you, and
Yeah,
you're
for
doing it
sure.
for all the right reasons. And I'm really, really happy to be a part of it.
Thank you. All right. We'll see you soon.
See you soon. Bye.